like to begin by saying a few words about the unbelievable kind of numbers that we've been putting up. And as I said, the number of 3%, the pace in the second quarter, we smashed all expectations. They thought it would be maybe a little bit less than 2, and it was 3, a little bit more than 3. Consumer spending is up, business investment is way up, domestic manufacturing is way up, real disposable family income is up, and personal savings are up. Other than that, we're not doing so great. We have the hottest country, and I'll tell you, it's a great, we're having a lot of fun with it. At the same time, we dramatically slashed government spending for the second quarter in a row, down nearly 4%, which people were surprised at. We do a lot of cutting also. The private sector has boomed with nearly 600,000 jobs added, way above expectations, while we have reduced the federal workforce by 70,000 jobs. So these are private jobs that are coming back to our country. Federal jobs are being cut. Critics said that our tariffs would hurt the economy, but the data shows the exact opposite, and the exact opposite is happening. The U.S. Treasury has taken in $150 billion from tariffs, and we'll be adding about $200 billion next month for totals that nobody's ever seen before, frankly. And foreign imports were down 30% in the second quarter, while the domestic auto production surged by a stunning 36%. How about that number, Dr. Oz? Right? That's good. That's good. We want to do that with your patients, too. We'll have a very healthy, we're going to have a very healthy country. This afternoon, we're gathered to announce another historic victory for the American people, very important one. Today, the dream of easily transportable electronic medical records finally becomes a reality. For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we're doing. The existing systems are often slow, costly, and incompatible with one another. But with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people. Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech Ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health. The key breakthrough we've made is getting many of the biggest names in the healthcare and technology to agree to industry-wide standards for electronic medical records. All of those great companies that you just heard have gotten together with this group of very brilliant people. The key breakthrough we've made is getting many of the biggest names in healthcare and technology to agree to that those standards of electronic medical records that we talk about and you've heard about for so many years, and now it's happening. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things. Sir, they can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If I got a problem, I don't want to know about it right now. But it is amazing what they're doing. I don't know, does it actually work? Can they do that? All right. Well, then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about. I'm less concerned than anybody. I say whatever it is. But people are very, very concerned about the personal records. They want to keep them very quiet, and that's their choice. I think it's a great thing because it'll be absolutely quiet. Instead, doctors and patients will always remain in control.
About 3 weeks ago, I met with the Indonesian health minister. And Indonesia today is regarded as the highest flourishing nation on earth. Since 1990, it has increased the lifespan of its women by 8 years, of its men by 9 years. There's no country that has a record like that. And there are two major innovations that allowed them to achieve that extraordinary outcome. And one of those was to disincentivize people from eating processed foods. You are paid not to eat processed foods, and you are penalized for eating processed foods. The other innovation that really transformed Indonesia was allowing people control of their individual health records. He showed me the app that they use that everybody in Indonesia has. And it shows your height, your weight, your blood type, your BMI, your cardiac markers, your diabetes markers, your cholesterol, and any kind of individualized treatments that you've had. So if you go to a doctor in another town, he doesn't do what we have to do here, which is to sit there with a clipboard and a fax machine in order to get your health records. It's available, and it allows them to give better treatment. And he, after his retirement as prime minister, he ran a commission to reorganize the Australian health system, and they revolutionized it, and they vastly improved health in Australia. And he said the single thing that he did that was most important to that transformation was the transparency that occurs when people control their own health records, because it gives people the choice over their own health decisions and over their own lives, and it gives them a sense of responsibility and allows them to measure the interventions if they change their diet, if they change their exercise. It can show you how many steps you took today. It can tell you if your glucose is spiking. And all of that information will now be available to American citizens. 60 years ago today, we passed Medicaid and Medicare in this country. And we have 60 CEOs in this room of these extraordinary companies, some of which the president just mentioned, that have all agreed voluntarily to start sharing information. About 3 months ago, I met with the food executives, and I asked them to voluntarily come forward and get rid of food dyes, of the 9 synthetic petroleum dyes. And this is something, again, the government, Democrats and Republicans have been trying to do for 20 years. And the industry came forward, and now 40% of the food industry in this country has taken the pledge to remove food dyes from all of their foods. That happened because of your leadership, Mr. President. A month ago, we got, after a lot of work by Chris Klump and Dr. Oz and a lot of other people in our agency, we got all the insurance executives to come together in our country and in our offices and agree to get rid of pre-authorization for 80% of the DSM codes. This is a voluntary agreement. 80% of the industry has now agreed to do that. So this is happening because of good leadership. President Trump, you've asked us to think big. You've inspired us to dream big, and you've enabled us to accomplish things that no other president has been able to do. So I want to thank you for your leadership, for allowing this to happen, and with your leadership, we're going to make America healthy again.
I recently got a text message from a friend whose wife has been suffering from a chronic illness for something like a decade, and they've been trying to figure out what it is. They've never been able to figure it out. And I just want to read this to you right off my phone. He said, I uploaded my wife's blood work into one of our leading AI engines on Friday. It essentially diagnosed her as having a rare genetic defect that causes bone marrow failure. It's caused every single thing that's happened to her. She has every single symptom. It started at exactly at the same age of presentation. It's 10 people out of 1 million. There's absolutely no way this is not it. So wow, it's really an incredible example of what AI is already able to do just today, and we're just getting started. And this was one person putting his wife's data in one of our consumer AI apps, and he's already been able to get that diagnosis, and that's going to help them tremendously. The key here is the unlocking of the data, because the more data that AI has, the better it performs. And so, kudos to Dr. Oz and Secretary Kennedy for this pledge today. They were able to get 60 major companies across different sectors of the economy to agree to unlock their data so that AI can use it to drive better patient outcomes.
But first, I've got to do what doctors often have to do, which is to tell you the truth, even if you don't want to hear it. So here goes. These beautiful programs, which are the backbone of the social network, the social support system of this country, the safety net, they're flailing. They're flailing for a bunch of reasons. Medicaid is a unique entity. It has deviated from its original purpose by drift and by design. The One Big Beautiful Bill, the OB3 law, was elegant for that very reason. And President, I don't know if you remember this, I can share this, but he called me once and he was upset at me because I was going too strident at something. And he said, this is about fraud, waste, and abuse. That's what we're interested in doing. And that's exactly what the One Big Beautiful Bill accomplished. And it especially did it to save Medicaid by putting $200 billion more dollars into it and allocating funds very specifically to use to support rural America. And primarily, some of that money will be used to support digital infrastructure, which is terribly lacking in many parts of the country. Unfortunately, this system is frozen, and it has been for many reasons, despite efforts in the first administration. It's frozen in time, so it cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern-day America. They're also tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore, and today we made that vision into a reality. But I'll tell you the best thing of all, how many of you have been with your doctor telling them something heartfelt, very emotional, and they're looking to the side, typing into their computer, right? It's common. Put your hands up. I just want to see it. Yeah, most everybody. And that's unfortunate because the whole sacrament, the whole covenant of being with the doctor is having them look you in the eyes and realize you're there for each other. That process is going to go away. We will, within the workflow of doctors, be able, with your help, allow physicians to take care of patients, gather the information while they're doing it, and will destroy the upcoding that has hurt Medicare Advantage and other programs in a similar fashion.